this point, I'm going to turn things over to Marty Williman to begin the didactic portion of our echo.
Thanks, Margie, and rest of the team. It's great to be with you here today. I've got quite a few slides, so I'm going to get right to them. And I'm going to move through them pretty quickly because I do want to allow enough time for the case presentation and hopefully come up with some strategies and answers for this family. The objectives for today is to understand the physical, the emotional, and the financial impact of dementia caregiving on today's families in America. And we'll talk about some tried and true strategies, some that have been around for decades and even longer. And then we'll talk about some new and creative strategies for caregiving, some that are just developing, some that are a little bit more into the future, and some that are available right now. And we'll also talk about some local, state, and national caregiving resources. So the stats around dementia caregiving are pretty amazing, I think. You know, there are, in 2020, caregivers of people with Alzheimer's and other dementias provided over 15 billion hours of informal care, and that equates to about $256 billion. If you're like me, these numbers don't mean a whole lot. They're too big for me to wrap my head around. But how much is $256 billion? Well, it's about 50% of Walmart's net value for the fiscal year of 2020, about 50% of Walmart's net value. Lot of dollars. More than 11 million Americans provide unpaid care for people with Alzheimer's and other dementias. And this is astounding to me. The lifetime cost of a care of one individual with dementia is estimated at close to $375,000. I remember when I started in dementia care, we estimated that it was between 150 and 200,000, and now we're up to almost $375,000, and that would be the estimated value. 70% of that lifetime cost is borne by family caregivers, and that comes in the form of unpaid caregiving hours, out-of-pocket expenses, like things for food and medicine, etc. In Ohio, we have over 440,000 dementia caregivers providing unpaid care in the hours of 590 million hours. And again, the value is close to $10 billion. That's just here in Ohio. You might know that we are one of the leaders in the nation in terms of dementia incidences. We are the 7th highest of all the states in the country. So who are dementia caregivers? Well, over half are providing assistance to a parent or an in-law. About 10% are providing help for a spouse. About 2/3 are women, and 30% of caregivers are 65 years and older. And over 60% of caregivers are married, or they're living with a partner or in a long-term relationship. And 2/3 of the caregivers are white, 10% Black, 8% Hispanic, and 5% Asian American. And the remaining 10% represent a variety of other racial and ethnic groups. So I know that's a lot of stats. I find these numbers just really staggering when we think about the number of people that are impacted with dementia caregiving. And last but not least, approximately 40% of dementia caregivers have a college degree or more of education. So why do dementia caregivers provide assistance? Well, there's 3 main reasons. They want to keep a family member or a friend at home. Proximity to the person with dementia is a consideration. And then this perceived obligation to the person with dementia. Caregivers often indicate that love and a sense of duty and obligation are motivators for them to assume care responsibilities for that family member or that friend. So we know that there are a lot of different kinds of dementia, and the type of dementia often dictates the care needs, and it often dictates the level of caregiver stress and the type of caregiver stress. When we think about different types of dementia and how they affect different parts of the brain, For example, in frontal temporal lobe dementia, we see that in the frontal lobe, that's where our judgment, decision, planning is made. And in the temporal region, our language. So for an individual who's living with frontal temporal lobe degeneration, we might see more difficulties with judgment and inhibition, personality changes. For someone with Lewy body dementia, we might see more challenges associated with visual and auditory hallucinations. And with Alzheimer's disease, we see more trouble with short-term memory and apathy and depression. So the type of dementia often does impact the caregiving and the caregiving stress levels of that individual. So while everybody with dementia is different, we all know that, and they're going to be different depending on the type of dementia that they have and then the stage of dementia. So generally speaking, this is very general that we're talking about here. With early stage dementia, we usually start to see the need for assistance with those IADLs. Not necessarily the ADLs, but the IADLs, those instrumental activities of daily living. Things like shopping and meal preparation, caring for the home, finances, caring for the finances. Individuals might need reminders of appointments. Establishing a routine is very important in the early stage of dementia. Might need help with some medication schedule, pill boxes, those kind of things. There's a need to monitor for safety with activities like driving and operating machinery and those kind of things, just monitoring those safety needs. And then the need for financial and legal planning. In the middle stage, the general care needs are going to be more focused on ADLs, those activities of daily living. So things like bathing and dressing and eating and medication management. Again, maintaining routines is very important. Adapting and adjusting to changes in communication abilities for that person. There'll be a need for transportation assistance, as usually in the middle stage, driving abilities do change and accommodations need to be made around that. Added supervision and safety monitoring in the home and or at work or outside. And in the middle stage, we might start to see some incontinence of bowel and bladder beginning. And the late stage of dementia care, the needs are going to focus more around mobility, eating, chewing and swallowing become difficult, putting people at risk for aspiration pneumonia. So modifying the types of food that will avoid choking or decrease the risk for choking. Increased risk for infection in the late stage of the disease. And we think about bladder infection, but we also think about things like sepsis and pneumonia as mobility decreases in the late stage of the disease. People are at risk for those complications for decreased mobility and bed rest, things like skin breakdown, infection, blood clots, those types of things. And certainly in the later stage of dementia, the communication becomes more and more limited, and perhaps at the point where the person is not able to voice verbal communication, but we all know that nonverbal communication remains forever. So the impact of providing care for older adults, compared with caregivers of people without dementia, twice as many caregivers of those with dementia indicate substantial emotional, financial, and physical difficulties. And almost 60% of family caregivers of people with dementia rate their emotional stress as high or very high. Just think about that, 60%. Spousal caregivers are more likely than non-spousal dementia caregivers to experience increased burden over time. And keep this last stat in mind as we go into the case study, that caregivers of people with dementia who have a comorbid condition, in this study it was diabetes or osteoporosis, they're over 2.5 times more likely to report emotional difficulties compared with caregivers of people with dementia who didn't have these co-occurring conditions. And we also know that caregivers of people with dementia are going to provide care for a longer period of time compared to other conditions. And well over half of family caregivers provide care for 4 years or more. What are the positive aspects of caregiving? A sense of fulfillment, the establishment of that extended social network and friendships associated with caregiving, that feeling of being needed and useful, learning something new about self-care and the meaning of life, etc. We could certainly add to this list, but these are some of the documented positive aspects of caregiving. And I'm a former caregiver, and the older I get and the more far removed I get from my caregiving experience days, the more appreciation I have for it, the more I realize how I grew during that period of time, how my children grew because they were middle school kids when they were helping to caregive for their grandparents. So I think, again, like anything, if we look hard enough, we can find those positive aspects. Just a couple things about sharing caregiver responsibilities. Just really looking at who's on the care team and who's good at what. So that person that's good at fixing everything, that last bullet that you see there, assigning those duties, or hopefully people in the care team will speak up and say, this is what I'm going to handle. I'm good with the numbers. I'm going to take care of the financials. I'm good with communication. I'm going to keep everybody updated. So I like this slide in terms of figuring out who can do what. Unfortunately, it doesn't always work that way, right? Unfortunately, sometimes we have a lot of caregivers, available caregivers in the situation, but all of this on this list seems to fall into the primary caregiver. But I've also seen over the years that sometimes it's just a matter of that caregiver speaking up and saying, this is too much for me. And these are some tips for how that caregiver can share that. If they're not good about announcing that face-to-face, they might try writing an email. They might try scheduling a family meeting, and there are different organizations that can assist with that family meeting. Might set up a shared online calendar and a scheduling tool where people can sign up for tasks and respite care. The caregiver might just block out a period of time that they can say, what can I do to help? And the caregiver, this is what I always stress with caregivers, be ready with that answer when someone says, what can I do? Have your answer prepared. Next Tuesday, I've got a hair appointment. I'd love for you to come over at 2:00 and stay till 5. But caregivers also need to know that they have to be understanding if they're turned down and not to be afraid to ask later. So these are just some tips for long distance caregivers. I live 3 states away from my mom. What can I do to be helpful as a long distance caregiver? And these tips are all located in this nice little infographic from NIH. I'm not going to read through all of these, but I hope that you'll access this tip sheet along with some other really great tip sheets from this resource for the caregiving things that we're talking about here today. So when we talk about some strategies for caregiving, these are some of the tried and true strategies for caregiving. Spending time with friends, joining a support group. We have a lot more virtual options for support groups because of COVID, and I don't think those are going to go away. Keeping up with hobbies, exercising is huge. Meditation, aromatherapy, setting up a respite zone in the home, especially for caregivers where perhaps the wife is taking care of the husband. It's just the two of them. Just having that zone for that caregiver to go to, just to get away if possible. Again, a lot of these are ideal situations that are sometimes not possible, but nonetheless, I think it's a good list for caregivers to keep in mind. And it's available again on this nice infographic. The way to find respite care, there are some national associations that help with locating respite care in your area. And certainly in Ohio, we look to the area agencies on aging as a good resource for those respite care. This Well Spouse Association, I don't have time to go into that right now, but that's kind of a unique organizations that just advocate and address the needs of individuals who are caring for chronically ill or disabled individuals. These are some other options for respite care. It might be in-home adult day. It might be through an assisted living or hospice care. And then paying for the care certainly is a big challenge for a lot of individuals. So there is financial assistance by different payer sources, Medicare, Medicaid, VA, and financial assistance by the care location. These are going to vary from state to state, even county to county, sometimes they vary. So it's just a matter of really getting connected to those individuals who can help sort all of this out. And again, the area agencies on aging in the different regions of the state are very helpful resources for that. There are some programs that may compensate family members in dementia caregiving. These are wonderful programs that provide some financial assistance for family members who are in that caregiving role. And again, these vary from state to state, and even funding resources as well. So just a couple slides about creative and new strategies. For early stage, we think about pill boxes to manage the meds, automatic shut off on some of the appliances. There's even monitors to let concerned family members know whether that coffee maker has been shut off, and then they can actually turn off the appliance from their phone, their smartphone. And then these object locators, they're small beepers that can attach to frequently lost items like the TV remote or things like that. In the middle stage, we think of more automated medication dispensers where an alarm goes off when it's time to take that medication. And if it's not taken, then the next of kin or a caregiver is notified. Stove knobs that cover, protect from use of the stove, dementia clocks, medic alert, and other personal emergency response systems. Those can be clipped on the clothing or worn as a lanyard. Talking photo albums. These are technology for in-home care. Again, the appliance use monitors, there's voice reminders, in-home video reminders as well. Just kind of going through these quick because I'm running out of time here. I think we've covered a lot of these. And then the voice assistants. Dementia, I've worked with a lot of early folks who are living with early stage dementia who rely on their Amazon Echoes or their Google Nests for reminders or for just answering questions, setting up a calendar, those types of things. And then more and more individuals who are diagnosed with dementia have had some years of experience with the smartphone. So using that, adding apps for dementia, for entertainment or for caregiving. The Let's Create Pottery and the My Reef 3D aquarium actually lets you set up an aquarium and put in the fish that you like, and it's very interactive. So all sorts of cool apps for that we can use on the phone. This Iridis is an app where you can walk through your house and it will make recommendations on your lighting, your use of color, how your furniture is arranged to make it as dementia friendly and safe as possible. Futuristic technology, this is another fascinating area. These telepresent robotics, there's one that's called Giraffe, and it actually maneuvers around the individual with dementia, it maneuvers around in their home. And then the caregiver from long distance can interact with that individual. They can walk through the house, so to speak, and kind of check on things. They're very expensive. They're over $10,000, but the robotic pets are a little bit more These are around $100, and it's a kitten that the person can hold on to. It's very realistic looking. It responds to touch and so forth. And then the augmented reality glasses, those aren't out yet, but we really feel like these are going to be some options for allowing people with dementia to navigate and understand their spaces that they're in. So thanks for bearing with me on that. That was a lot of information in a short period of time, but you will be getting this slide deck and the links to all of the resources that I put in here. Those are going to be live. Just a shout out about this alzheimers.gov. This is a wonderful website, as well as this dementiacarecentral.com and the Family Caregiver Alliance. We know that those are great websites as well. So I hope you'll take some time to check out these resources. And finally, my contact information, as well as our Ohio Council for Cognitive President, Dr. Bonnie Berman, and finally my reference page. So Margie, do you want me to go right into the case study now? Or Denise?
Are there any questions for Marty for?
Sorry. Thank you, Denise. I was talking away muted. Yeah, we just heard from Dr. Drost. Wow, there are a lot of technology options that may be helpful. Yeah, there's a lot that I learned today. Thank you. So now, if there are any other questions or comments, please make sure we get them in the chat and we'll address them.
Yeah, I just a couple of observations. I know it's really hard to determine sometimes at what point this person should not be left alone before a tragedy happens. I know of a couple of instances where the family didn't realize certain things they weren't capable of. I know of a woman that got hit by a car. I know of a gentleman who was babysitting his toddler grandchildren, and he took them to a restaurant, and when he was done eating, he got up and left and forgot about the kids. So and I guess the physician would if they have regular physician visits and they give them that dementia test, make sure that happens on a regular basis. How often do you think that should happen? Should that just be an annual thing, or maybe it should be more often? To prevent something like this happening, or maybe the family just wasn't observant or educated enough.
Dr. Drost, did you want to take that?
So my challenge is that it's so much more than just a test that we can do in the office, and I think that really is a challenge, just where our healthcare system is at this point in time, for a lot of particularly primary care doctors to have that time to sit down and not only do that testing, but hear from the person, hear from the family of what areas they may be starting to struggle with, and to provide a lot of that education. I mean, it would be ideal, right? If somebody's noticing memory changes, to come into the doctor, they do an assessment, and be able to spend that 20 minutes, a half hour, an hour sometimes with families, explaining those. And these are the things to start looking for. And these are really the areas of concern. We call it the 4 M's, of the areas that are the biggest, potential risk: medications, money and financial management, mobility, including driving, and meals. So, eating. So those are some of the high risk areas that we worry about. But that's a lot of information, and often in geriatrics and sometimes in neurology, when we have those pieces, that's important. What I think though is that if you're getting that inclination that there's a memory problem, yes, definitely bring it up to the individual's medical team, but to seek out those other resources. And that's why participating in this type of thing is so important, because the Alzheimer's Association, the Area Agency on Aging, providing a lot of those education and support pieces for patients and families to know when to start getting worried, and what those things could be. And from there, it's really discussing not only with that individual who has a diagnosis of dementia, but also family of what risks are they willing to take. Some families accept a lot more risk, a risk of falling, a risk of injury by continuing to live alone, perhaps, whereas other families are absolutely like, nope, that's a no-go, right? They start falling, they don't know 911, like those things, then that's where we are getting them out of the home or putting more supports in home. So navigating that risk becomes a little bit more challenging too. Those are some awful situations though that you've experienced.
Thank you.